Glenohumeral joint treatment can also be done with the Spencer 7-step technique, often called the 7 stages of Spencer. This is a mostly articulatory technique with one section being muscle energy. Articulation in this case requires nagging. It is not a position that is obtained, but rather a motion against a barrier, against motion resistance. The patient is placed in a lateral recumbent position. The affected shoulder is uppermost, the head is supported, and the knees need to be greatly flexed in order to let the patient feel stable on the table. Please make sure that the shoulders are stacked so that the upper shoulder is directly above the lower shoulder, and use good stabilization of the shoulder with the hand wrapping around the front and the back of the affected shoulder girdle. Include the clavicle and the scapula under your hand. The operator begins by gently flexing and extending the arm in the sagittal plane with the elbow flexed. Repeat this until you meet the limit of pain provocation. The rhythmic swimming motion is then repeated with the arm extended, making sure that the arm, if possible, covers the ear in your forward swing into flexion. The operator then circumducts the patient's abducted humerus with the elbow flexed. Clockwise and counterclockwise concentric circles with gradual increase in range are made within the limits of pain. The operator will then circumduct the patient's humerus with the elbow extended in both clockwise and counterclockwise circles, increasing range as permitted by pain. The operator will then abduct a patient's arm with the elbow flexed and gradually increase the abduction against the stabilized shoulder girdle. The operator then places the patient's hand behind the rib cage and gently springs the elbow forward and inferior, increasing the internal rotation of the humerus. So internal rotation can be increased either in this step by articulation as shown here, or by gentle muscle energy with the patient pushing back against the hand with his elbow. In the final step, the operator grasps the proximal humerus with both hands, encircling, and applies lateral and caudal traction in a pumping fashion. Once a fluid motion is obtained or the joint stiffens because of being heavily treated, stop and retest.